Hello and welcome everyone to our speaker coffee chats for our 17th annual Canadian Holistic Nutrition Conference. We are very excited. This year the topic is Holistic Nutrition, Exploring the Spectrum of Wellness. We have two dates. We are in Calgary, Saturday, April 12th, and Toronto on May 10th. I'm Joanna Brown, your social media manager for the Canadian School of Alumni Nutrition, and we are proudly presenting the conference this year, and I am very excited to have one of our Calgary speakers joining us today. Thank you, Jessa Landmann, so much for joining us.
Thank you. I'm very excited to be here.
Yeah, now your topic, nutrition across the cancer care continuum. Can you tell us a bit about why you're so passionate about this topic?
Well, topic is just one aspect of what I do as a naturopathic doctor. So I guess the topic being nutrition. So as a naturopathic doctor, we're trained in a lot of different things. So I do a lot of acupuncture, a lot of helping with exercise as well, many different things. Cancer care generally, I'm very passionate about because I think as a doctor, doctors really want to feel like they're really making a difference. They're really doing something. They're really, actually helping people. And this is a population that I always feel like I'm really making a difference in their lives. People come in often feeling very very hopeless. I'm just gonna feel like this forever. Maybe if they're after cancer care, maybe I'm gonna be tired forever or not feel well forever. This is my new norm, right? And kind of having that conversation with people about recovery and like, you know what, we can get you back to where you were before, right? And it gives a lot of people hope, and it can be really life changing, just kind of getting people's lives back. So working with people with cancer and a history of cancer, it just feels really good, I guess, too. Naturopathic medicine and complementary therapies, and just whether you want to say, the word natural treatments as well,
Mhm.
they make very profound differences in people's lives too, right? And so, I think sometimes people are used to just getting a prescription medication for various symptoms, and sometimes it's just going back to those basic foundations of health.
Mhm.
And so that's another reason why I love bringing naturopathic medicine to cancer care. I love talking about nutrition with my patients. It is by far the number one question I get asked on an almost daily basis is,
Mhm.
what should I be eating? As nutritionists, you probably know there's a lot out there on the internet, eat this, don't eat that, this is bad, this is good. And it is, in the cancer world, it's really, really confusing. And people get a lot of mixed messages, and sometimes, want to be proactive and make changes on their own, but those changes that maybe they think are the healthiest, might not be the best for them, like in that given moment. There's a lot of different fad diets and stuff. So so I think for a lot of people, nutrition sounds really complicated, and they feel very confused about what to eat. And I often say, the stress about what you're eating is probably worse than what you're actually eating. So I really love to break it down and really kind of, I would say, like, simplify it, and remind people that food is meant to be enjoyed, and here's how we can use it therapeutically. Here's what healthy might look like, and that's not black and white. Everyone is different. So what I might recommend to one person might be totally different to another, based on if they have other comorbid conditions, or what their digestion is like, or food sensitivities, or many things, even history of eating disorders, things like that, right? It has to be very very individualized. So I guess that's why I love that.
I love it. I love it. Now, what can we expect from the presentation at the conference this year?
Yeah, so the topic is about nutrition through the cancer care continuum. So the cancer care continuum really is from the moment of diagnosis, through active treatment to, I guess, post-treatment rehabilitation, secondary prevention type of thing. So from diagnosis to treatment, that phase is also referred to as prehabilitation. And it's actually kind of an under-recognized phase or stage, I guess you could say, and for the importance of it as well. I'm really thinking of it as, what can we do to build a person up so when they're going into treatment, they're as strong as possible and feeling as good as possible. And there's so much that you can do. So really just kind of talking about, the goals of that stage. The treatment stage, there's so many different possibilities of what someone's going through, right? So whether they're going through radiation or whether it's different hormone therapies or chemotherapy, there is an endless, possibility of side effects from things we might already think like fatigue or loss of appetite, to diarrhea and constipation, to weight gain or weight loss, of course, like, nausea and vomiting. I'm not sure if I said that already.
Mhm, mhm,
Pain, like, so many different things, right? And it's like, okay, what can we do to help people? And, as I mentioned, there's a variety of modalities that I use, but nutrition is always a big part of it. So what can we do maybe for, symptom management?
mhm,
That from an evidence-based
mhm.
point of view as well. And then the last part of that continuum would be, into recovery. So people are like, I'm done cancer treatment. I want to get back to feeling as good as I possibly can. I want to get back to my old self, kind of thing, right?
Mhm.
And then also, but what can I also do to make sure cancer never comes back again? And there's a lot of research in that phase as well. So we'll go through the whole continuum and how we can help.
Amazing. Now you're speaking to a big group of nutrition lovers, right? So,
Yeah.
will you be sharing some very tangible strategies or things that we can take away and use with our clients that might be going through this continuum?
Yeah, I definitely hope so. That's always the goal. Everyone wants to learn something they can take back, and maybe they're writing notes of people that they have in mind. So, I know I don't need to teach you about like what foods are going to be high in antioxidants, or whatever. Like you probably know that, right? But there might be little things that, yeah, you might not have thought of, or maybe it's just a research area that you don't have experience, haven't read much research in, and just kind of hopefully like sharing that research, the evidence behind that, and yeah, that you could take away and use, tomorrow if you had patients in your practice who fit that, kind of fit the cancer continuum at some point. Yeah.
Beautiful. Now, we always love to ask all of our speakers if there's be a fun fact about yourself or a hidden talent maybe people don't realize about you.
I wish I had a hidden talent. I
Yeah.
really do. Well, a fun fact that I guess I should share is actually I'm writing a book. It's on cancer-related fatigue, so very specifically about fatigue. It is something that honestly is almost non-existent and one of the longest standing, one of the most common long-term side effects that get cancer patients experience. So that's been really fun. I'm really excited about that. Like I've been in practice for 12 years and had a clinical practice for 12 years. And sometimes you think like, what else can I do? I want to give back and contribute in a different way. And I'm hoping this is something that can, yeah, really reach the masses and help. So yeah, so that's fun.
Very fun. Very fun. That's very fun. Very exciting. Amazing. Amazing. Well, congratulations for that. And thank you again for sharing your story. We cannot wait to see your presentation in Calgary. If you have not got your ticket yet, please go to csnnalumni.org under the conference tab. Get your ticket. And whether you attend the Calgary or Toronto, your ticket will get you all the speaker recordings. So if you're out, in Toronto, don't worry, you don't want to miss this presentation on cancer. You will be able to get the recording afterwards. The conference is open to all wellness practitioners, students, and the public. The early bird tickets are on sale now. Thank you again so much for taking the time to talk with us today. I will be in Calgary this year, so I'm very excited to come and see your topic or your talk live in Calgary.
Thank you. I'm excited to be there.